friends, my name is Dr. Kannan Kumar. I am an upper limb and hand surgeon from Bangalore. My practice is exclusively hand and upper limb surgery. A lot of patients have got in touch with me through social media and other means regarding elbow stiffness. Right? So a lot of patients are not clear about elbow stiffness. Elbow stiffness is a very common problem after any kind of trauma to the elbow. Unlike other joints like the wrist or the knee or the hips, the elbow has an unnatural tendency to become very stiff after most trivial of injuries. Even you may have just a soft tissue injury or a dislocation and the elbow becomes very stiff. Why does this happen? This is probably because the elbow has a very thick capsule. So the elbow has a very rigid and structure, and because of which the elbow tends to become very stiff. Most important thing is we have to start early range of motion of the elbow. And we should not do two other things. One is no passive range of motion. So nobody should force your elbow, push it. If they push it, it will become more and more stiff. The other thing that you should not do is you should not massage the elbow. You should not. So a lot of older people in the family advise or Ayurvedic massage. When you go and start massaging the elbow, it becomes more and more stiff. So what should you do to the elbow? Early active range of motion, early active assisted range of motion. So nobody should put too much pressure on the elbow, nor should you massage too much of the elbow. So these are some of the prerequisites for the elbow to be functional without any stiffness over a period of time. But we have a lot of patients who come to us after a certain period of time. Like for example, somebody walks into my clinic after 2 months with elbow stiffness. We gently ask them to go back to therapy and slowly proceed therapy. So the patient usually is unable to continue to gain any elbow motion after 6 months. That is when we can sometimes consider surgery. When do we consider surgery for elbow stiffness? One is when the patient is not having functional range of motion. So when they're able to extend up to 30 degrees and able to flex up to 130 degrees, that is a functional range of motion. The patient is able to reach the hand, do his activities, do cleaning and do all other activities. That is a functional range of motion of the elbow. When this 30 to 130 degrees is not achieved, then is when we go and think about surgical intervention, and that too after about 4 to 6 months after the injury or primary surgery. So how do we release the elbow? We can do it either via arthroscopic means, that is we make 2-3 small holes, pass in a video camera and release all the tissue around the elbow, and then we can mobilize the elbow. The second way is we can do an open surgery, that is we make an incision, we open, release all the tight structures around the elbow including capsule, remove the extra bone found, remove other ligaments or muscles which are preventing the elbow from moving. So you do that in an open fashion, that is you make a large incision and then you remove all these structures and mobilize the elbow. The key after either an arthroscopic elbow release or an open release is that you should mobilize the elbow as early as possible. Again, active and active assisted range of motion, no passive motion and no massaging of the elbow. In spite of all this, we usually do not achieve 100% range of motion. We probably achieve about 80 to 90% of range of motion. We have a large series of such patients who have been operated in the last 10 to 12 years with good results, and we have published this in international journals, and also we have presented this in various fora, and we have got good feedback with this. So if you are one of those people who have elbow stiffness following trauma or for any other reason, please do get in touch with us. Our team will be able to help you with elbow stiffness and get back function and mobility of your elbow. Thank you very much.